When the first draft of the human genome was published in 2001 after 13 years of work and $3 billion in costs, it seemed like genome sequencing would remain a process reserved for large research institutions. Few could have predicted that just over a decade later, an individual's full genome could be sequenced for $1,000 in under a day. On the surface, this dramatic reduction in time and cost has opened up exciting new possibilities for medical care tailored to a person's unique genetic profile. However, one often overlooked impact may end up being among the most profound. How direct-to-consumer accessibility of complete genetic data will change societal attitudes towards genetics and health. As genome sequencing becomes integrated into mainstream healthcare, more and more individuals will gain a very detailed view of the genetic factors that influence their risk for hundreds or even thousands of diseases and conditions. However, the data could be interpreted by different people in very different ways. While this knowledge could empower people to take preventative measures, it also introduces new kinds of uncertainty. Some may find themselves distressed to learn of substantially increased lifetime odds of severe illnesses like certain cancers or Alzheimer's disease, even if symptoms have not yet emerged. This could fuel an inevitability effect where individuals feel their fate are irreversibly written in their DNA, undermining motivation to make healthy lifestyle choices. A few studies has indeed found that learning of an elevated genetic risk can paradoxically decrease perceived control over health outcomes. As genetic risk profiling expands, insurers and employers may also be able to access and interpret the data. Gaining unprecedented access to individual profiles could enable new forms of discrimination. As sequencing costs drop, it is inevitable that more and more people will have their full genomic data incorporated into electronic health records without a complete understanding of how this data could potentially be used against their interests in the future. This introduces difficult questions about genetic privacy and data security. How can healthcare systems help everyone who wants genetic counseling? There may not be enough experts when more people get DNA tested. And what education will help individuals meaningfully comprehend results, showing increased lifetime risk for 50 or more diseases at once? Without systems in place to thoughtfully guide the interpretation and application of genomic insights, there's a real possibility many will feel distressed after sequencing without truly actionable information. In some ways, directly putting complete genomic blueprints in individuals' hands may be premature without the infrastructure to properly support the responsibilities and complexities this level of genetic insight introduces. While early knowledge of disease risk could absolutely benefit public health by helping to prevent certain diseases, one often overlooked but potentially most challenging of all may be how societies will grapple with questions of genetic determinism, discrimination, and privacy protections in health that widespread genomic data access raises. If guided well, this revolution in genomic technology holds tremendous potential to transform medicine and improve lives. With responsible policies and education, society can maximize its benefits while ensuring individual privacy and well-being as the study of our DNA expands in new and profound ways.